Hey guys, now we're going to start in chapter 16 for the urinalysis. Again, like I always tell you guys, it's going to be your responsibility to read the whole chapter. I'm only going to hit on the big points that I want you to highlight. Okay, so we're going to start on page 577 for the structure and function of the urinary system. Highlight that the function of the urinary system is to regulate the fluid and electrolyte balance of the body and to remove waste products. The urinary system consists of the kidneys, the uterus, the urinary bladder, and the urethra. The kidneys are bean-shaped organs approximately 4.5 inches long and 2 to 3 inches wide. They are located in the lumbar region of the body. Urine drains from the kidneys into the urinary bladder through two tubes known as ureters. All that needs to be highlighted. If we go on down to where it says the urinary bladder is a hollow muscular sac that can hold approximately 500 milliliters of urine. Its function is to store and expel urine. The urethra is a tube that extends from the urinary bladder to the outside of the body. The urinary meatus is the external opening of the urethra. In males, the urethra functions in transporting urine and reproductive secretions. In females, the urethra functions in urination only. That needs to be highlighted. Also highlight that each kidney contains approximately 1 million smaller units known as nephrons. The nephrons is a functional unit of the kidney. If we go on down to the composition of urine, you need to highlight that urine is composed of 95% water and 5% organic and inorganic waste products. If we go and look under the figure 16.1, please become familiar with that. And then I also want you to highlight that it says a normal adult excretes approximately 750 to 2,000 milliliters of urine per day. You also need to go down a little bit and highlight that an excessive increase in urine output is known as polyuria, with the urine volume exceeding 2,000 milliliters in 24 hours. Polyuria may be caused by the excessive intake of fluids or the intake of fluids that contain caffeine, such as coffee, tea, and cola, which is a mild diuretic. Certain drugs, such as diuretics, and the pathologic conditions of diabetes mellitus, diabetes insipidus, and renal disease may also result in polyuria. Decreased or scanty urine output is known as oliguria. In the case of oliguria, the urine volume is less than 400 milliliters in 24 hours. Oliguria may occur with decreased fluid intake, dehydration, profuse perspiration, vomiting, diarrhea, or kidney disease. The normal act of voiding urine is known as micturition. You need to become familiar with the terms related to the urinary system. If we go over to the guidelines for urine collection, you need to highlight number 1, where it says usually 30 to 50 milliliters of urine. Number 2, where it's labeled properly with the patient's name and date of birth. Number 3, any medication the patient is taking should be documented. For number 4, if possible, the collection of urine specimens should be avoided in women during menstruation. For number 5, the medical assistant should take in consideration that voiding may be difficult for patients under stress and anxiety. Number 6, urine specimen may be difficult to obtain from a child, even with the assistance of a parent. If we go over to on the other side on page 579 for the first voiding morning specimen, in many cases, the first voided morning specimen may be desired for testing because it contains the greatest concentration of dissolved substances. A clean catch midstream specimen, you need to highlight that it says, whereas the distal urethra and the urinary meatus normally harbor microorganisms. If the urine is being cultured and examined for bacteria, a clean catch midstream specimen is necessary to prevent contamination of the specimen with those normally present microorganisms. If you go down to the next paragraph, you need to highlight where it says, void a small amount of urine into the toilet, which flushes out microorganisms in the distal urethra. If we go on over to page 580, You need to highlight under the 24-hour urine specimen where it says a 24-hour specimen is often used in diagnosis of the cause of kidney stone formation and in the control and prevention of new stone formation. If we're looking at procedure 16.1 on page 581, you do need to become familiar with this procedure, but I want you to highlight D on the number 3 procedural step. If we go on over to page 584, under the analysis of urine, highlight that a urinalysis is the analysis of urine and is the laboratory test most commonly performed in the medical office. Highlight that a urinalysis consists of physical, chemical, and microscopic examination. If you go down a little bit further, you need to highlight that it says a urinalysis may be performed as a screening measure as part of a general physical examination or to assist in the diagnosis of a pathologic condition. It also may assist in the evaluation of effectiveness of therapy after treatment has been initiated for a pathologic condition. A urinalysis should be performed on a fresh or preserved specimen. That needs to be highlighted. If we go on down to the next paragraph, you need to highlight that it says if the urine is allowed to stand at room temperature for longer than 1 hour, some of the following changes may occur. Number 1, urine becomes alkaline, which increases the pH. Number 2, a cloudy specimen. 3, if glucose is present in the specimen, it decreases in the amount because of the microorganisms use the glucose as a source of food. And number 4, if any red or white blood cells are present, they may break down. And number 5, casts decompose after several hours. If we're going to look at the physical examination of urine, you need to be familiar with the color. The normal color of urine ranges from almost colorless to dark yellow. Dilute urine tends to be lighter yellow in color, whereas concentrated urine is a darker yellow. If we go down to the third paragraph, you need to highlight that abnormal colors may be caused by the presence of a hemoglobin or blood, resulting in red or reddish color, bile pigments resulting in a yellow-brown or greenish color, or fat droplets or pus resulting in a milky color. For the appearance, you need to highlight that cloudiness in a freshly voided specimen may be the result of presence of bacteria, pus, or blood, fat, yeast, sperm, mucus threads, or fecal contaminants. Also highlight that the cloudiness resulting from bacteria may be caused by a UTI. If we look under the odor, you need to highlight that the urine that has been staining for a long time develops an ammonia odor. For the specific gravity, highlight that the specific gravity of urine measures the weight of the urine compared with the weight of an equal volume of distilled water. If you look at the next paragraph, you need to highlight that the normal specific gravity of urine ranges from 1.003 to 1.030, but is usually between 1.010 and 1.025. The specific gravity of distilled water is 1.000. Specific gravity varies greatly with fluid intake and the state of hydration of an individual. Dilute urine contains fewer dissolved substances and has a lower specific gravity. Concentrated urine has a higher specific gravity because of the increased amount of dissolved substances. When we're looking for the chemical examination of the urine in the second paragraph, you need to highlight that where it says, chemical tests that are routinely performed during a urinalysis include testing for pH, glucose, protein, and ketones. Other chemical tests that may be performed include testing for blood, bilirubin, urobilinogen, nitrate, and leukocytes. You need to become familiar with qualitative test results and quantitative test results. All right, and if we're going to continue on page 586 under the pH, you need to highlight that where it says a pH reading of 7.0 is neutral, a reading below 7.0 indicates acidity, and a reading above 7.0 indicates alkalinity. On page 587, you need to highlight where it says, although the pH of urine can normally range from 4.6 to 8.0, the pH of a freshly voided specimen of a patient on a normal diet is usually acidic and has a pH reading of about 6.0. For glucose, normally no glucose should be detectable in the urine. On page 588, highlight where it says diabetes mellitus is the most common cause of glycosuria. And I do want you guys to go ahead and read over table 16.1 on page 588. If we go on over to page 589 under the ketone, you need to highlight the following. Large amounts of ketone accumulate in the tissues of the body fluids. This condition is known as ketosis. The body rids itself of these excessive ketones by excreting them in the urine. Ketonuria is a term that refers to the presence of ketone bodies in the urine. Conditions that may lead to ketonuria include uncontrolled diabetes mellitus, starvation, and diet composed almost entirely of fat. Which if you guys know of the keto diet, that is a keto diet that's mostly consumed of fat and protein. So this may be common found in that. For the bilirubin, you need to highlight that certain liver conditions such as gallstone, hepatitis, and cirrhosis may result in the presence of bilirubin in the urine, or bilirubinuria. Again, some of these words still cannot pronounce to this day. All right, let's look under the blood. You need to highlight that unless it is present at the contaminant during menstruation, the condition in which blood is found in the urine is termed hematuria. For the nitrate, you need to highlight where a nitrate is in the urine indicates the presence of pathogens in the normally sterile urinary tract, which results in a UTI. If we go following on the other side on page 589, it's going to be the very next sentence. Highlight that therefore use of the first voided morning specimen is recommended. For leukocytes, you need to highlight that the presence of leukocytes in the urine is also known as leukocyturia. For the reagent strips, highlight that in the medical office, reagent strips are the most commonly used in diagnosing urine testing kit. I want you to become familiar with table 16.2 on 590 and 591. If we go on over to page 592, if you look at the figure 16.6, this is the check sticks controlled strips. On number 6, you need to highlight the storage of reagent strips. The reagents on the strips are sensitive to light, heat, and moisture, and the bottle containing the strips must be stored in a cool, dry area away from direct sunlight, with the cap tightly closed to maintain reactivity of the reagent. I want you to highlight on procedure 16.3, you need to highlight number 5, and that also includes procedure for number 5. Become familiar with procedure 16.3. If we go to page 596, you need to, under the microscopic examination of urine, you need to highlight where it says the first voided morning specimen is typically preferred because it is the most concentrated and contains more dissolved substances. For the red blood cells, you need to highlight that the presence of 0 to 5 per higher power field. If you go down a little further under the red blood cells, you need to highlight that a concentrated urine causes the red blood cells to become shrunken and crenated. For the white blood cells, you need to highlight that the presence of 0 to 8 per 8 pH is considered normal. If we look under the cast, you need to highlight that casts are cylindric structures formed in the lumen of the tubulus that make up the nephron. On table 16.3, this is just kind of good to look over. It gives you kind of what some of these types on urine will look under the microscope, as well as a description and possible causes. It's really good to read over. If we go on over to page 603, I want you to highlight where it says yeast cells in the urine of female patients are usually a vaginal contaminant caused by the yeast Candida albicans and produce the vaginal infection known as candidiasis. That needs to be highlighted. If we go on over to page 608, under rapid urine cultures, a urine culture is used to assist in the diagnosis of a UTI and the assessment of the effectiveness of the antibiotic therapy for a patient with a UTI. That needs to be highlighted. For the urine pregnancy test, under or above the human chorionic gonadotropin, highlight where it says these tests are performed on a concentrated urine specimen and rely on the presence of a hormone known as the human chorionic gonadotropin, HCG, for a positive reaction. If we look on page 609 for guidelines for urine pregnancy testing, highlight number 1 where it says use clean, preferably disposable, urine containers to collect the specimen. Number 2, the preferred specimen for a urine pregnancy test is the first voided morning specimen. And number 3, where it says a specific gravity of less than 1.007 is considered too dilute for pregnancy testing because it may lead to a false negative test result. And number 4, the urine specimen should be at room temperature. On number 8, you need to highlight where it says if the internal control does not perform as expected, the test result is invalid and the specimen must be retested. Please become familiar with procedure 16.5 on 611. And then I want you guys to become familiar with the terminology review on page 615, but especially of the following: anuria, diuresis or dysuria, frequency glycosuria, hematuria, mecturition, nocturia, nocturnal urenesis, oliguria, polyuria, pyuria, and retention. You need to become familiar with all of them, but especially those that I went over and their word parts. And then if you look on 616, you also need to become familiar with the urgency and a urinary incontinence.